Hey everybody, it's Robin, and welcome to my learning and teaching plan about chronic heart failure. Heart failure occurs when the myocardium cannot pump effectively enough to meet the body's metabolic needs. Symptoms of heart failure may restrict a person's ability to perform ADLs and severely affect their quality of life. The leading causes of left ventricular failure are left valvular disease, hypertension, cardiomyopathy, disease of the pericardium, thyroid problems, and obesity. Right ventricular failure can result from pulmonary hypertension, right valvular disease, myocardial infarction, and advanced left heart failure. Here's a little bit about what goes on in heart failure. In left ventricular failure, the left ventricle is unable to pump blood from the ventricle to the aorta and the body. This deficiency results in blood that pools in the alveoli of the lungs, causing pulmonary edema. The problem with the heart is therefore a problem with the pumping function of the heart. When the right ventricle of the heart fails, the right ventricle cannot receive all the blood that returns from systemic circulation and/or cannot pump the blood to the lungs. In this case, venous pressure is increased and results in congestion of the viscera and the body's tissues, resulting in widespread edema. With all of that going on, this is what the body does to compensate. When the volume of blood that is being ejected by the heart decreases, epinephrine and norepinephrine are secreted by the sympathetic nervous system. This activates the renin-angiotensin-aldosterone mechanism. This means that sodium is retained and fluid follows. The fluid volume of the body is increased, and therefore the workload of the heart increases as well. Muscle fibers' contractility is reduced. In order to compensate for this increased workload, the muscle becomes thicker. So since this is a nursing class, we're going to go through the rest of the video using ADPI. So for our assessment, we're going to go look at some symptoms of chronic heart failure. Some of the symptoms of left-sided heart failure include shortness of breath during activity, low oxygen saturation, fatigue, cough, and crackles or wheezing due to edema upon auscultation, tachycardia, and restlessness. As for right-sided heart failure, the patient might experience hepatomegaly, splenomegaly, and ascites, which can lead to gastrointestinal distress and loss of appetite. You might also see distended jugular veins and swelling of feet and ankles. Alright, now let's look at some nursing diagnoses that can apply to heart failure patients. Some of these include risk for skin breakdown, decreased cardiac output, activity intolerance and fatigue, ineffective tissue perfusion, and risk for impaired gas exchange. For our planning, we might expect to see some changes to the patient's nutrition plan. So these changes include sodium restriction and fluid restriction. Patients with ischemic heart disease are usually also put on a low-fat and low-cholesterol diet. For planning, I've also included some common medications prescribed to heart failure patients. The planning aspect might include familiarizing yourself with these medications and knowing what they do and some common side effects. One class of drugs that is often prescribed to patients with heart failure is angiotensin-converting enzyme inhibitors, or ACE inhibitors. These are prescribed to promote vasodilation and diuresis. Exercise tolerance is expanded and heart failure progression is slowed down. A common example of these medications is, of course, Ramipril. Another common class of medications used for heart failure is angiotensin II receptor blockers, or ARBs. These improve cardiac output by decreasing blood pressure by decreasing vascular resistance. An example of this is losartan. We also have beta blockers. These cause the effects of the sympathetic nervous system to be reduced. A common one of these is metoprolol. There's also diuretics. These manage the fluid overload by increasing urine output. Of course, we have furosemide or Lasix. Be sure you're watching those potassium levels, as furosemide can often make them really low. The last medication class I'm going to mention is calcium channel blockers. These reduce systemic vascular resistance and therefore cause vasodilation. An example of this is amlodipine. Now for implementation. Some simple nursing interventions we can do are oxygen therapy to improve oxygen saturation, and physiotherapy for the patient's lungs, or as nurses, we can just ask them to deep breathe and cough. Depending on the patient's situation, they may be receiving a pacemaker for conduction problems, or a cardiac transplant as a survival strategy for younger patients with end-stage heart failure. Another important intervention is education. As one of the professionals that spends the most time with the patient, the nurse needs to provide education regarding their condition and treatments. The aim is to empower the patient to take control of their condition to the best of their ability. It's also important to focus on nighttime comfort. Since one symptom of heart failure is orthopnea, the nurse needs to help the patient find the most comfortable way to sleep. If necessary, oxygen can be administered. Patients may also experience angina or musculoskeletal pain. It's important to notify the physician about this so analgesics can be prescribed. Medication for insomnia can also be prescribed if needed. As we know, exercise is important for everyone. It's important to determine the optimal level of exercise that the heart failure patient can tolerate. It is in the best interest of the patient to be kept active for as long as possible. Fluid balance, perfusion, and edema should be monitored regularly. The patient should also be weighed regularly. It's important to determine if the patient's fluid overload is being addressed and if the patient adheres to their low sodium and fluid restricted diet. Renal function, fluid intake, and urine output are also important factors to monitor. Assessments aren't usually considered interventions, but with the circular nature of the nursing process, it's always a good idea to keep these in mind. Specific continuous assessments include lung assessments and respiratory rate, and oxygen saturation levels, heart rate and auscultation, ECG monitoring, and blood pressure. As for evaluation, we need to always be looking at our goals and interventions to see if any changes need to be made. So that's my presentation. Thanks so much for watching. Like, comment, and subscribe.